am Jacqueline Mars. The health disparity that this project is centered around is the life expectancy difference between men and women. During this presentation, the following topics will be covered. 1. Past data. Looking at past data is important to see what the difference is and how long it has been like that. 2. Why the life expectancy gap is a health disparity. The term health disparity will be defined and how the life expectancy gap qualifies as a disparity is explained. 3. Causes of death. Looking at the causes of death and the differences between men and women is important to see where the gap is coming from. 4. The reasons that the gap exists. By looking at the reasons behind the disparity, a solution plan can be made to eliminate the disparity. 5. Societal expectations. This is one of the reasons that the life expectancy gap exists, and the specific societal expectations will be talked about and how they affect men and their life expectancy. 6. The ideologies that are taught to young men. This is another reason that the life expectancy gap exists, and the specific ideologies will be talked about and how they affect men and their life expectancies. 7. The stigma around men expressing their emotions. This is the final reason that the life expectancy gap exists, and the stigma will be explained and how it affects men and their life expectancy. 8. The impact on families. This slide will talk about how men are not the only group of people that are affected by this disparity, and specifically how it affects the families of men who die prematurely. 9. Biological reasons. This slide explains that there may be some biological reasons affecting the life expectancy of men. 10. Comprehensive plan. The 3 different levels to the comprehensive plan will be introduced and explained. 11. Community strategies. This is the first level of the comprehensive plan, and the different strategies that could be used are given and explained as to how they would work. 12. Individual strategies. This is the second level of the comprehensive plan, and the different strategies that could be used are given and explained as to how they would work. 13. Policy strategies. This is the final level of the comprehensive plan, and the different strategies that could be used are given and explained as to how they would work. To start, there is data available on the life expectancies of men and women since the year 1950. The data shows that women have lived longer lives than men since 1950. As shown in the top graph, there is a gap of about 6 to 7 years until around the year 2000, when it decreases to 5 years consistently since then. According to the CDC, life expectancy at birth for men was 75.8 years, and for women it was 81.1 years. So there's about a 5-year difference still. The future hypothetical graph shows that it would take until the year 2190 if the trends continued linearly for the life expectancies to be the same. Realistically, it would take even longer than that because it is not likely that this process would be linear. So, why is the life expectancy gap a health disparity? According to the CDC, health disparities are preventable differences in the burden of disease, injury, violence, or the opportunities, and they are directly related to unequal distribution of social, political, economic, and environmental resources. So, if a specific group of people is affected differently from another, and it is due to social factors, it meets the requirements. Therefore, the life expectancy difference is a health disparity because 1. It affects one group of people differently than another group. Men live shorter lives than women, meaning they experience premature death, and it is often due to preventable things like suicide and vehicle accidents. 2. It is driven by social factors. There are some biological factors involved. However, the social factors play a large role. Some examples of these factors are that men are more likely to partake in dangerous activities and they are less likely to seek medical care. 3. It is avoidable. This is an important part because it means that there is room for improvement. To see where the gap is coming from, looking at causes of death and comparing the differences between men and women is important. There are some causes of death in both men and women that are not included here. However, the main causes of death to focus on are unintentional injuries, suicide, and motor vehicle traffic, because they are the causes that root from the social factors. As seen in the graph on the right, the number of deaths due to unintentional injuries in men is about 110,000, while only 60,000 in women. So almost 2 times as many men are dying due to unintentional injuries compared with women. The same pattern follows for suicide and motor vehicle traffic deaths. There are almost 40,000 men dying from suicide and about 10,000 women. There are about 25,000 men dying from motor vehicle traffic and 10,000 women. All of these differences are significant enough to prove that they play a large role in the life expectancy gap. There are 3 main reasons that the health disparity exists. First, there is stigma around men expressing their emotions. From a young age, boys are taught not to express their emotions. They are told that showing sadness or vulnerability is a sign of weakness and that they should not cry. This causes them to be less likely to seek help for mental health related issues, and instead they keep their stress to themselves. The second reason is the ideologies taught from a young age that men should be risk takers and fearless. An example of this is that young boys are told that they should be brave, and this leads to dangerous situations that men put themselves in. The third reason is the societal expectations that men should be tough and not seek help. This results in impacts on both mental and physical health. An example of this is men being less likely to go to the doctor unless they think it is serious enough. All of these reasons play a role in men's behavior and health and explain the life expectancy gap. Starting with the societal expectations, men are often expected to be strong, unemotional, and independent. These traits end up causing men to be less likely to seek medical help because that would mean that they are not strong or independent. An example of this is a man avoiding the doctor so that he appears to be strong. Then a condition could get more serious and lead to treatment not being as successful. Then also, because they don't feel comfortable expressing their emotions or talking about them, they do not seek help in ways such as therapy or even talking to someone close to them, such as a friend or family member. The data in the pie chart shows that out of all of the health center visits, men are only responsible for 34.8% of them, while women take up the other 65.2%. If men felt more comfortable visiting health centers, it could drop the suicide rates in men. This slide talks about how the risk-taking behavior leads to the life expectancy gap. The ideologies taught from a young age that men should be risk takers and fearless lead to men partaking in more dangerous activities. As a result of these teachings, men are more likely to participate in risky activities such as reckless driving, substance use, and ignoring safety precautions. These behaviors result in a higher likelihood of injury or death. This is shown in statistics on car accidents. Men are twice as likely to have been in one car accident and 3 times more likely to have been involved in 2 or more car accidents. This shows a pattern of repeated dangerous behavior. According to Courtney, government health surveillance systems are providing increasing evidence of gender differences in specific behaviors associated with risk among nationally representative samples. Data from one such system indicate that the prevalence of risk behaviors among adults is more common among men than women for all but 3 of 14 behaviors, including smoking, drinking and driving, using safety belts, getting health screenings, and awareness of medical conditions. These outcomes are a direct result of the influence that these ideologies have on men. This slide talks about the stigma around men expressing their emotions compared to women. According to Murphy, women have also had socially sanctioned resources to ease psychological pain in ways such as crying, fainting, illogical thinking, physical weakness, and tantrums. The stigma that men face around expressing their emotions causes them to deal with their stress in unsafe ways. They are also less likely to seek help through therapy. According to Vogel, male friends and family members may be particularly unlikely to refer men to seek mental health services, as it means going against the traditional male gender role prescription of talking to other men about emotional issues. This is what causes the higher rates of suicide in men. This disparity does not only affect men, it also affects their families. Around 40% of widows fall into poverty within the first 5 years of their husbands dying. This statistic shows how much families are impacted by the premature death of men. Often, men provide the main income in a household, and if they die early, the family loses a major source of income. This causes difficulty for the family to pay for basic needs like healthcare and housing. This also could cause stress for the whole family. This shows how much of an issue the life expectancy gap is and how many people it can affect. The life expectancy gap is not only due to social reasons. There are some biological factors that come into play. Some examples of the biological reasons include earlier onset of cardiovascular disease in men, and there are some health advantages that come from hormones that enable pregnancy and childbirth. However, the social factors are the ones that society can work on to work towards a decrease in the life expectancy gap. In order to address the health disparity of the life expectancy gap between men and women, a plan must be made with multiple levels of solutions. There are 3 types of strategies that can be used. The first one is community strategy. The community strategies focus on reducing the stigma that men face and changing societal expectations through the intervention of all of society. The second strategy is at the individual level. The individual strategies require men to have more involvement in the process, but this can be done by providing men with the resources to change their behavior. The third strategy is the policy strategy. These focus on larger level interventions that require funding. According to Addis and Mahalik, any strategy that increases the perception of normativeness for particular problems should be effective in facilitating help seeking. Public service announcements, magazine advertisements, and psychoeducation in employee assistance, educational, and religious contexts may help challenge perceptions that problems in living are uncommon for men. Another method Addis and Mahalik mentioned is famous men associated with traditionally masculine qualities who have sought help for emotional difficulties can be used as examples of adaptive help seeking. These strategies fall under the community strategy because they require changes of social norms around masculinity that must be upheld by all of society. By pushing the idea that needing help is normal for men, it can reduce the stigma that men face. According to Addis and Mahalik, internet discussion groups, life coaching workshops, and other creative strategies need to be developed and tested. These resources would provide men with the opportunity to talk to other men that are experiencing the same thing and discuss healthy ways to cope. Internet discussion groups, for example, could also be anonymous so that men could build up the courage to reach out without them exposing their identity. That way, they might be more comfortable actually seeking help. Then, once they have done that, they could be more comfortable reaching out for life coaching workshops or therapy once they take that first step. This qualifies as an individual strategy because it requires the individual men to reach out and join the groups. One policy strategy mentioned by Whitley is marketing. The Men's Health Center retained the services of a social marketing firm to launch a citywide social marketing campaign on men's health. The goal of the campaign was to increase the visibility of the center, encourage men to seek health care, and spark new collaborations. This could be beneficial because if it is being pushed to the general public as normal advertisement, men might be more likely to reach out for help. Whitley also states that nationally there is growing support for the establishment for an Office of Men's Health that closely models the Office of Women's Health at the Department of Health and Human Services. This office would bring more attention to men's health disparities and actively try to improve men's health outcomes. They could put funding towards research and even towards the marketing strategies mentioned earlier. This is a policy strategy because it requires government action and national funding.